We wanted to do a short video around CPAP masks and how to appropriately advocate for certain things like this when it comes to your child. So my daughter Mia wears a CPAP. She has worn it for a few months now and had a sleep study back in February of this year, which determined that a CPAP was ultimately the best sleeping option for her. She wears this mask on the right. It's a SleepNet Mini Me 2, and it has worked wonders for her. This mask right here, Philips Respironics, otherwise known as a giraffe mask for many, is a very widely known mask that many kids that wear CPAP wear, and many hospitals and locations have this mask on hand. So naturally, this is the mask that they put on Mia during her sleep study. So as you can see, this is the nose piece here, and then this is the part that wraps around the head. Mia did not do well with this mask in her sleep study. It did not go well at all, and she was very upset. It took multiple hours to calm her down. We were able to finally get her to sleep a bit, and they determined that the CPAP is the best option for her. When her sleep medicine doctor told us that, I took it upon myself to advocate to get a different type of mask because I knew this mask was not the best fit for her, as what really was the issue is this just did not fit around her head well. The way her head is shaped, it did not go over her head well, and then this nose piece was riding up against her eyes, and it was not a good fit. So we advocated and we said there has to be other options. You know, something has to fit her tiny little nose and face and head better. And we went through different masking options with our sleep medicine doctor. We ultimately landed on trying this Mini Me 2 mask. As you can see, the nose piece is actually a little bit bigger, but it's a gel and it kind of just fits right over the nose, and then you can push the gel to form very much over the area surrounding the nose so it doesn't ride up. Also, the head part on this just went around my daughter's head better, and we have stuck to this mask, and she honestly loves wearing the CPAP now. We have had issues getting this mask from local DMEs. It's much harder to get. We also had to bring it with us when she just had her tonsils removed, and she had to wear it in the hospital because our hospital, which is very large actually, doesn't carry this mask. They only carry this mask right here, which is very common. So Philips is very widely known. You know, they're very much out there, and you may be told that this is the only option, but we want parents to know that there are other options out there, and these aren't even the only two options. There's another mask called a Pixie, which is supposed to be very good for small kiddos as well. We have not tried that mask, but it is one that I would like to trial, so we have a backup option to this Mini Me 2 if it does work. But we really just want you to know that, you know, there's options out there. You don't have to settle for what your doctor says your child is going to get. You have the right to ask for other things that could work for them if what they are trying is not fitting your child right or not working. If you have any questions or anything, please feel free to reach out to the Edwards Syndrome Association or put them in the comments, and we are gladly to see if we can answer your questions around this topic.